So I should be recording now. Hi, everyone. Thank you for joining and welcome to our Girl Up SoCal Coalition Reproductive Health Workshop. So I'm really excited to introduce our speakers and our interviewer for today's workshop. We'll have a Q&A session at the end, so keep thinking of any questions that you might have and drop them in the chat if you want to ask them right away. There's totally chill, just ask and feel free to speak up whenever. But just to introduce our speakers, we're really excited to have two speakers from the Alameda County Public Health Department. I was really grateful to meet them and to have their support with this workshop, and we can't wait to hear from them today. So we have Cruz Santana, who's an interim MPCH coordinator and Healthy Start director, and Karla Navarro, who's a prenatal services coordinator, both at the Alameda County Public Health Department. So they're experts in the field of reproductive health, and we're really excited to hear from them. And today we also have Rania, who will be asking our interview questions, and she's the activities coordinator for the Girl Up SoCal Coalition. So we'll just get started. So Rania, if you want to take it.
Yeah, thank you, Tanya. And I can start, Dana, if that's fine.
Oh, I thought they were going to ask a question.
Oh,
All right, go ahead, Karla.
you can go ahead with the question, sorry.
Okay, hi. To begin with the first question, what sparked your interest in the field of reproductive health?
So I'll share for me. I grew up in East Oakland, so I've always lived in Alameda County, aside from the time when I went off to college. And growing up, I never knew anything about public health. It wasn't a field that, I knew anybody that was working in. It wasn't something that we were introduced in school, about. I didn't have a lot of resources when I was growing up. And so this field was completely brand new to me. And I didn't learn about it until I started working after college, came back to the Bay Area. I knew I wanted to be in the same community that I grew up in. And so I started working with pregnant and parenting teens. And while working with them, I, started learning about some of the barriers to care that they were experiencing, some of the challenges that they were having in navigating healthcare, navigating social services in our community. And I knew that I wanted to do something more to help, but I was limited in my current role. And so going in meetings, doing that type of work, I started learning about the public health department and some of the programs that they had, and initially started kind of connecting my clients to those programs, and then slowly learning more about exactly what public health did. And when an opportunity for an opening came up with the health department, I knew that it was something that I wanted to pursue because I wanted to be able to help more people, to have more of an impact in my county and be able to kind of help bridge some of those gaps in services that we had, and to make sure that, everybody in the community knew of all the great services that the health department had to offer, and that they were able to access them. And so I wanted to essentially increase access to different services, specifically reproductive health, because I always felt like it's a field and it's an area of health that a lot of people tend to shy away from discussing. And so a lot of the youth that I was working with, they had no idea that they could get free or low cost services. They didn't know where to go if they needed family planning or, if they needed prenatal care. And so being able to work in a field and being able to share more information with them was something that I became passionate about, and something that has brought me a lot of joy. And it's been really rewarding to be able to see that some of the challenges that some of the youth that, I grew up with and that I worked with are not there, because now we have more access to the information. Now we have more access to the resources. And I always make sure that I reconnect with the high schools in the area, especially the one that I attended, to make sure that their students know that they can get services in our county.
Yeah, so again, I'm Dana, and I think my first, it raised my interest in reproductive health is when I needed services myself. So that would have been around the age of around 18, when I was in college and I started dating and I got my first boyfriend. So, I never doubted that I would finish school, and that was in my mind. So I'm really appreciative that I already had the vision that you're going to finish school in college, right? So I know I had to do something, and I just went to the student health center, and I was able to, prevent a pregnancy and stay healthy all through my college years. And then, once I started working, I had taken on my pre-meds and thought I wanted to be a doctor, but like Karla, I didn't know about public health. So I thought that's if you want to help people and you're interested in health, be a doctor, right? But I started to learn that I really like talking to people more than like touching them. Like that, I really enjoy the kind of conversations, especially when what it did to me when I started to receive information and I was like, wow. And so that never went away. And so right after college, I started working for a local clinic. Some of you may know it if you're from the East Bay, La Clínica de la Raza. And I was a health educator, outreach worker. And it was at the time when they had money to help people learn about the risks for HIV, to prevent AIDS. And that was the big concern at the time. But all of it's connected because, people are, what they're doing, their behavior, their activities, what they do sexually, all culminate in one person and in through relationships. So it really, even though we were funded to do one thing, it really meant you had to talk about everything. And so I said, well, maybe I want this work more. I started meeting other people who had degrees in public health, and that was their profession. And so I decided, after working there and then also doing some school-based working with families, I finally said, you know what? I'm not gonna study for the MCAT. I'm gonna learn about public health and what schools, can meet my needs. And luckily I was able to enroll in a program, first in the Master of Public Health program. And when I got there, I learned that there was a dual program for, you could do a Master of Social Work and a Master of Public Health. And it's really what I wanted, but I was scared that I'm like, what if I can only handle one? But once I got there and I learned my way around and I saw like, okay, I can do this, then I was able to apply my second year the MPH program. And then, so I have a Master in Social Work and a Master in Public Health. And it really is like the perfect thing for me because, again, as I said earlier, I always saw like the social reasons and the relationship issues that affected health and affected how we felt and what we did and what the outcomes were. And so it really allowed me to get a lot of knowledge and skills around, from anywhere from human development and families and all the way to like understanding like epidemiology and, outbreaks and, infectious diseases, chronic diseases. It was really informative. I've been working for the Alameda County Public Health Department for it's going to be 23 years in February. And I worked in maternal child health this whole entire time. And seriously, what's kept me going was I want women and people, all people, to be able to manage this part of their life and get what they want out of life. I mean, when it comes down to it, our reproductive health determines a lot about oftentimes what our outcomes are going to be and what we're going to be able to do. And so I just want people to have the information and I want them to make the choices and kind of design and build the life that they want to live. Currently now is I work with the maternal child health director who for the county of Alameda, and I support her in being able to comply with all the policies and funding and requirements that the state of California has for every county in California. Yeah, that's me.
And I forgot to share, sorry. So I've been with the Alameda County Public Health Department for over 11 years. And like Dana, I've worked in MCH and maternal child health the entire time. And I've actually been in the perinatal services unit since the beginning with the county. And so, it's been great to work closely with Dana and other staff that are passionate about helping our community, and ensuring that we cover all of the pregnancy options so that everyone knows that they have rights, that they have options, and that there are services that they can access. And so it's been great.
Wow, that's really great and inspiring from the both of you guys. Um, do you are you like shocked of where you guys are from? Was this like when you were exposed to this, was it, oh, I'm definitely going to do this? Or did it take a couple of years to really realize, that this is something you want to do the rest of your life?
I can say that, what I saw, and, I was, definitely, someone who had, worked with teen women, worked with new moms, did teen pregnancy prevention. It all, like I said, it all kind of melded together. But I think when it kind of all became clear to me was when I saw the difference that it made for a young woman or a person with a uterus to have resources to be able to design and determine what you're gonna have in life, what being able to decide when you are going to initiate childbearing is a huge thing, and you should be thinking about it. We're going to be, any person with a uterus, woman, it's going to be menstruating and being able to be reproductive age for about 32 years of your life, right? And so if you want to have, let's say, 2 children, it's going to take about a year to have each one. So now you got 30 years to figure out how you're not going to have any, right? And I just really became fascinated with that reality for women, and that there needed to be support and resources and education and policies that would support women being able to make those choices.
I would say for me, it started in college. So growing up, I grew up in a very strict home. And so, sex was never discussed. All we learned was whatever they taught us in school, and that was it. And so it was always a taboo topic, and especially in my community also. And so I was, not aware of all the different consequences that sex could have, and all the different options that someone that, had an unintended pregnancy had. And so when I got to college and I started taking, like Dana, I also thought I wanted to go pre-med. I started taking my science classes, and that's when I really started learning more about, how the body worked, and things that I feel like I should have, been able to learn younger. And I wish we, had been taught younger, is when I started learning them in college. And then, that made me realize that a lot of youth in my area where I grew up in didn't know any of this. And then once I started working after college, I wasn't sure if I wanted to do social work, or if I, what I wanted to do after college. So I had applied to a social work master's program, and I decided, let me take a year to work, do something similar in the field, and like truly know if that's for sure what I want to do, because I was still drawn to health. And so when I started working with the pregnant and parenting teens and seeing some of the challenges that they had, and the lack of knowledge, and the fact that a lot of them were parenting and were having a really difficult time, because they were parenting children that they did not want to have, but they didn't have an option. They didn't have a choice. Their parents didn't know, what to do. So it's like, well, you're pregnant, you're going to have the baby. And just in talking with them, it made me more interested in learning more of how I could support others that were, having challenging times deciding what they wanted to do, or not knowing what they could do. And just wanting to make sure that, whenever I came across someone that needed support, that I was able to give them information, not tell them what to do, but give them information and resources for them to make informed decisions over their bodies. So that's something that's always been, been very important, and something that, further drew me into the work. I definitely want to do this lifelong. I've been very happy doing the work, and I feel very grateful that I get to do something that I enjoy and that I feel like, it's making a difference. Whenever I get other people that are working in the community that reach out asking for resources or, asking for more information, and I'm able to share, or when I, put together family planning or reproductive trainings for providers in our area, it's very fulfilling, and it, really pushes me to want to do more to grow this part of our work further.
I want to say one more thing. Karla and I, we work in maternal child health field, right? So a lot of the emphasis is on pregnancy and infant. And every day we work with, our coworkers and work with clients who, many of them reluctantly have become mothers. It's kind of just because it happened. And I think what's so great about reproductive health in its entirety is when you deal with it from a reproductive health lens, you are trying to prevent reluctant motherhood, and you are trying to basically protect the opportunities that that young people have. And I think that that's why it's so exciting for Karla and I to be talking about this, because a lot of times, our work mostly centers around helping, people who may or may not planned a pregnancy and aren't prepared. And there's a lot of risks that come with that. But the good thing about reproductive health is you really are, it's prevention, and you are helping people get what they want out of life, and, protect their opportunities in their future until they want to have kids.
That's really inspiring for the both of you guys. Once again, thank you for coming here to share your journey. And as we get into this presentation, thank you for sharing all your knowledge. I appreciate it. We all appreciate it, because there's so much that we need to figure out. And as women, we all should know what it is. So thank you guys for your journeys. We can move on.
Okay.
So what role do organizations such as the California Department of Public Health play in supporting access to reproductive health education?
So the state is responsible for not only certifying and licensing medical professionals, right? That's one role that the state has. The state government also has the role of assuring, public health standards, things that keep us safe that sometimes we take for granted, sanitation, garbage, well-made sidewalks, all that kind of stuff. But they're also in charge of providing Medi-Cal or Medicaid services for folks that aren't insured or low income or qualify for Medi-Cal or Medicaid. I'm not sure if everyone's in California or not. So, basically the government gives them a whole big block of money and says, here, California, you work with your counties, your local health jurisdictions, and have them, meet the needs of their respective community. So that's actually a lot of the work that I do, is trying to figure out what the needs are. And then when we get our share of this money from the state, making sure that we're actually targeting the issues and the population that we're supposed to be helping with those resources. So, the state and the government has a lot to do with it, both from state to local level. But in reality, a lot of public health and reproductive health is really about people. It's really about what we share with each other, and the relationships and advocacy that we do for one another.
Thank you. For advocacy, how can we better share like preventative care for young women, such as the HPV vaccination? And how do you guys reach out to make sure that more people are aware about it?
Karla, do you want to take that one?
Yeah, so for advocacy, I think the biggest part of it all is for the youth to educate yourselves on what the issues are. What's affecting your population best. I feel like something we always discuss is that, the health department only knows, we see the data, we don't know the stories of everything that's going on in the community. And so, oftentimes we understand that youth is not coming to us, they're not going to their teachers, they're not going to their parents, they're going to each other, to whenever issues come about. And so our role is to provide resources, but we also need the community input. And so, if we don't know what's going on, we see the data, but we don't know the stories again. So it's very important for us to work closely with the community, collaborate. We have a lot of collaborative meetings with people that are working directly with the community, because they are the ones that are able to share what's going on with us, what challenges people are having, so that we can figure out, like Dana said, with the money that we do get, what can we do? What programs are we able to implement? How do we need to modify the work that we're already doing to fit the needs of the community at that given moment? A lot of the data that we have, it's not current. And so sometimes, it takes a couple of years for us to be able to see the impact of some of our programs. But if we're able to get feedback directly from community members around what they're experiencing, that's always helpful for our work. And in terms of us, making sure that people are aware of, like HPV or how to prevent it. The health department has different units. So we do have an STD and HIV unit that does a lot of education in the community. So they go out, they'll do presentations at libraries, at some of our schools, and you can always check in with your health department to see what programs they have. A lot of times, a lot of our programs, we're happy to go present when we're invited. And so I think it's important for you to be aware of what services are at your local health department, what programs they have. Again, our STD unit, they'll go out and do presentations. So they work closely with the schools. They'll do presentations at schools. They'll do presentations at libraries, at other places where youth is gathering. And, they try to make sure that the information is presented in a way for the youth to be able to understand. As if you become interested in public health and start in the work, you'll see that we use a lot of jargon and a lot of acronyms. And so it's very important for the information that's being shared with the community to be at a level where the community can actually understand it. So for us, it's always been important that, we make sure that our materials are low literacy, because we can't assume that everyone is going to be able to understand everything that we're putting out. And so we try to cover, people's different learning styles, make sure that whatever resources we have is available in different languages. Alameda County is very diverse. And so we always want to make sure that, we have at least some of the threshold languages so that our community is able to access the information, and we're not just putting something out that people are not going to be able to read or understand. So I think, I would say it's very important for that communication between the community and the health department, in order for us to be able to better serve what the needs of the community are.
Yeah, and on the individual level, I think the first place to start is, personally, like, know what your rights are, know what your reproductive health rights are, know what any of your rights are, really. This information is available, and people just don't know about it. And we, when you really think about it, we're so dependent on our parents in the early stages of our life, and they're the ones who determine and decide when they take us to the doctor, right? Especially when we're little. And then kind of like after the age of 10, we don't go so much, right? Because we're like bigger kids and we're busy with school and stuff like that. It's not, it's not like you have to come in for well baby checks. And then, a lot of times, a lot of us, when we reemerge back into the healthcare system, we're having to do it for ourselves, usually because we've become sexually active. And now, we're not, most young people may not involve their parents in seeking out those healthcare services. So be really aware of, like, pay attention to how life stages, how we have to do things differently. It's something our parents do when we're young. And then at some point when we start to approach adulthood, or definitely when we're in reproductive age, we do it for ourselves. And so with no information, and oftentimes, and so Karla and I want, we're here to help you guys be those kind of resources, to be the resources for your peers, so that they don't have to go at it alone. And so the first thing is to really understand your rights in your state. And we actually are availing this resource so that you can read it. It's a little long, but there's a really good chart in there that'll tell you for what different types of healthcare services do you need consent. I do want to say for pregnancy related conditions, there is no minimum age. You can be any age and seek out pregnancy related services in the state of California, with the exception of sterilization. But that doesn't mean that the system doesn't have an obligation to protect people who may be exploited, especially when you're young. So, you do have a right, but there's also laws that providers have to follow to protect young people. So, get the full picture of what's going on, basically.
Yes, that's really great. And I do think, yeah, more people definitely need to know about public health access. Right now in your public health department, you guys are willing to spread awareness. You guys want to make sure that people have access. But currently, we can go from your county because that's where you guys work. Where do you think the public health department lacks that you think that they should include and work on so they can improve themselves too?
Go ahead, Karla. Karla, do you want to take that or do you want me to take it?
I think we can both tackle it. I think for us, we're definitely interested in doing more work with youth. I think, well, as Dana mentioned, we're maternal child and adolescent health, but I think a lot of the focus, is usually on the maternal and the infant. So, we definitely try to have resources and information available for adolescents. But I feel like there's more than we can do, especially because we're competing against, information that's being shared on social media. And oftentimes it's information that's not accurate. And so, we have to combat that. We have to work hard at making sure that we're up to date on, what teens are interested in, because we can have all the information and materials in the world, but if people are not interested in looking at them, they're not going to get the information. And so for us, I feel like there's more that we can do in trying to make sure that we're reaching, all of the youth in our county. And, making sure that we're working more and having, materials and programs that are more community driven, so that the information is shared. Like I would love to have more pure health models in our county. And that's something that I think, we currently don't have, but hopefully can work towards.
So as Karla had mentioned, our maternal child health unit does focus a lot on pregnancy and infants and becoming new mothers. I think to some extent, we kind of fool ourselves into thinking like we're helping pregnant women, but I've always been the person to mention we're helping pregnant women who are going to end up having a child because either they chose it or that's the situation. We don't work with all women. Not all pregnant women, want to be put in, enrolled in a program where they're going to become a mother. And then there's many, many women who are trying to prevent and manage not becoming pregnant. And even though that should be part of what we do, and we kind of give ourselves credit for it, it really is an unmet need that is really, really huge. And the good thing is Karla and I locally, we have a lot of ideas and a lot of plans to to improve that, including coming to you guys and saying, can you help, can you be advocates, can you develop your own selves so that you can be a resource for others. So yeah, it's sometimes we, in a lot of ways, public health departments follow the money. Right now, there's a lot of money for mothers and babies with home visitation and helping them. Not so much for helping people have healthy sex lives and, protect their opportunities for work or school or career or whatever it is that they, whatever their dream is. Not so much money for that. So yeah, that's what I have to say about our unit and basically our field of maternal child health and reproductive health.
Yeah, I think funding is definitely something that impacts, all health departments, regardless of what county it is. And so, while we may feel like, there's certain work we want to do, there are limitations depending on what the funding stream is. And, some funding is for targeted populations. And so, depending on what county you're in, the programming may look different from the rest of the state.
Yeah, but we're not doing enough. I'll give you an example. I'm driving around in the East Bay. We're Karla and I are part of the folks that are responsible for making sure people know about, the legitimate resources and resources that are confidential and, respect your choice. But in a lot of ways, the pregnancy crisis centers that are anti-choice are doing a better job with billboards and I guess having visibility in the community. And that irks me. It makes me feel so guilty every time. But again, it's a process. You have to have policy, you have to have money, and you have to build relationships with people. And so that's what I meant when I said, in a lot of ways, this work is about relationships, preparing yourself, having relationships, and being a voice and being an advocate. And, Karla and I are already talking about how we want to address that. We want our messages up on billboards and signs and bus benches or wherever it is people are looking. So we have a lot of work to do.
I think you're muted, Rania. But just before that, I wanted to jump in with a question really quickly too, related to the Teen Health Law Toolkit. It sounds really interesting and like a really good resource. So maybe before we move on, if you can talk a little bit more about where we can find this and and how we can use it effectively.
Karla, can you?
Yeah, I can put the link in the chat, and then I can also actually follow up with you, Tanya, and put working on a document that has all the links for you to access. But we in searching, one of the things we want to emphasize is always make sure you know what sources you're getting your information from. And so this toolkit was put together to kind of walk you through minor consent, confidentiality. It has assessments, so it has materials that it's not only to help you, but you can make copies of, share them with your peers, share them with your parents. Make sure that your school is also aware. If there's people at your school that are there to support you, that they also know that these resources are available. So it does have health education handouts. Again, it has legal information, and so we know that laws are constantly changing, and so we always say make sure that if something's not current, that you try to find the most updated information. But this is a great starting point because it walks you through what all the laws are. And then as Dana mentioned, there's a chart that you can use. Sometimes it's easier to look at a chart that kind of breaks everything down because you can spend hours reading countless pages, but sometimes people will not understand, what everything means, or just having a visual makes it a lot easier. And so those are some of the handouts that you're able to share or, have for yourself as reference. If you are not sure if something is covered, or if you have the right to access certain services, that you can turn back to this and look at it.
Karla, you brought up a really good point about how the public health department has to compete with social media and false information that's out there. How can we, not just the public health, people who are aware of the situation, how can we dispel myths that are generated on social media that discourage young women from seeking preventative care and contraception?
I think it's very important, again, to know who you're following. I think sometimes, there are people will create different posts, and then they'll start sharing and they'll spread throughout the, social media pages. But it could be, you could put anything you want on a graphic, and then people could share it because they like the image, or, it's like, oh, well, this person shared it and I'm friends with them, or I know them, so they start sharing without really knowing whether that information is accurate. So I always say, if you see something, try to find the source for that information. Make sure that it's a legitimate source, that it's not just someone, posting their opinion. As Dana said, we do have the crisis pregnancy centers in our area, and they have a lot of money. They get a lot of donations, and so they're putting billboards that are very compelling to people, but they're not sharing other information. And so I think, there are legitimate pages that you can follow that will post information. Oftentimes, health departments will, now we're making more of an effort to have a social media presence. And so you might see that, sometimes they might have a page that you can follow and repost and share some of the things that they're, sharing. There's a lot of work that's being done to develop social media toolkits, for different health, like, if there's a month like for sexual health month, there might be some posts that the state or even the federal government will create to kind of share some information. There's, departments that are working really hard to put together easy to share videos, that you can repost or share with your colleague, with your peers, with your parents. But it's all comes down to making sure that the source is legitimate, and that you're not sharing something that you haven't double checked. I think, that's one of the biggest things is a lot of times, people will turn to Facebook, and a lot of older people are very guilty of this also. They will turn to Facebook, or, they'll search something up on Instagram or TikTok before they check in with their provider, their healthcare provider, or before they check in with somebody, that they know. It's like they'll just turn to social media. And so you have to be careful about what's out there and what you're putting out there. And making sure that you're vetting everything that you're following, and that it is a legitimate source, and you're double checking the information. And, if something doesn't seem right, I think, sometimes like you do have to question, and, you can help combat some of that by sharing posts that are sharing accurate information, by reposting again, those toolkits that are being put out now, where you're able to share now. The images are better. So, we're slowly getting there, but I think the youth definitely can play a big role in helping to, combat some of that sharing that happens with information that's not accurate.
Yeah, I would add, read as much as you can, because that's how you learn the landscape. And then once you kind of learn the language that's used by different interest groups in the field, you can identify pretty quickly when something is like not, is biased and not really meant to support, women making choices or people making their own choices. So, read everything, and then eventually you're going to have an eye for things, and you're also going to learn who are the institutions that are, reputable, and also, consistent with, people's rights and confidentiality. And so, just read as much as you can. Don't believe it all. And then if you expose yourself, you'll start to get a knack. I mean, now I can just kind of look at something. Karla and I, when we were preparing for this presentation, like, that's a waste of time, right? Because we already knew, we kind of saw the buzzwords and everything like that. And then we knew what things were legit. So, yeah.
Thank you. So moving on to period poverty, Girl Up leaders do a lot of work that cover menstrual equity. How can we help you guys, the public health department, and how can we help ourselves advocate for and go against like menstrual poverty and make sure that every girl has access despite their socioeconomic status?
Yeah, I think the first thing is to check in with yourself and your own feelings and perspectives on, menstruation, on your period. Let me ask a question. For anyone who's ever had to buy their own pads and tampons, what has anyone ever, I guess, can I raise your hand, or at least raise your hand if you have ever felt embarrassed to have to, pick them up and take them to the cash register, if anybody can say that. Rania, can you tell me if anybody's raising their hand? Like, did it ever feel like, everybody knows? It was embarrassing. Are there hands up?
Yes, I can see them. Yeah.
All right. Yeah, you know, and think about it. Do we feel that way when we buy toilet paper? Not so much or not at all, right? And I think that kind of shows the cultural stigma that is, normal, unfortunately, that has a lot of disdain for women and women's bodies. The fact that, you know, we wouldn't think twice about buying, a package of toilet paper, but then when it comes to menstruation, that we would feel a sense of shame and cringe and just feel uncomfortable and awkward. And maybe we want our mother to buy it, or our bigger sister, or somebody else. Says a lot about what society thinks and feels about women's bodies. So I think the first thing to do is to really explore your own feelings around it, and start to kind of say, where did I learn to think like that? What would be a way what way should I be thinking about it that would promote health and my well-being and that of others, right? And so this is an important issue. I'll let Karla chime in now.
Yeah, so I know that, we found the advocacy toolkit and you can look through it. So again, I'll put those links in the chat also, but I think it's important for you to be aware of, kind of what's supposed to be available. I do know that, oftentimes in schools, I don't know if any of you have come across this, but, there's usually the machines in the bathroom where they have tampons and pads, but they were always empty. And so one of the things that, I've come to realize as I got older is that a lot of times they were probably empty because no one said anything. I think, if you're too embarrassed to let staff or school administrators know that, hey, the tampon machine or the pad machine's empty, girls will find a way to, figure out like, okay, if I need to use toilet paper. I've heard different things from various people over the years of what they did because they couldn't, because I did check in with some friends. It's like, hey, what did you do when, we didn't have access to these things in our bathrooms at school? And so just knowing that a lot of times what kept us from having those resources was because no one was comfortable asking. No one was comfortable speaking up or saying anything to school administrators, to their parents, so that they could help advocate for them also. It's, if you feel shame because of something that's naturally happening to your body every month, it does say a lot about how we're being, how we're being taught as we grow up. And so I think it's important for us to kind of undo some of those things and speak up for ourselves. Make sure that you understand that this is something normal. This is part of what your body does. And it's okay if you need to have, to talk to an adult and say, hey, we're out of pads, or we need to have, more tampons in the bathroom. Because a lot of times, if you don't know how to speak up, you're not going to get some of the things that you want. And I think it's important for you all to, get more comfortable. And I know that it's really easier said than done, to just kind of break away from that shame, and know that this is something that you should have access to, and that you shouldn't feel shame. Like Dana said, you don't feel shame when you go buy toilet paper. And I think a lot of times is because that's something that's seen as like everybody needs toilet paper, whereas menstrual products are a little bit more specific. But we shouldn't feel that shame.
Yeah, I guess in a lot of ways, what Karla is suggesting is kind of have, period positivity, be period positive, right? And then with that kind of perspective, you allow more information to come in, as opposed to wanting to look the other way or just kind of shutting down and not having a voice around it. So develop a voice, your voice and your perspectives on menstruation. It's interesting because one of the resources that we have on here is there's actually a museum of menstrual history, and it was actually set up by a man. And the interesting thing about it is when he started it virtually, so he would put up pictures and information, the best he could. He wasn't a young guy, so the website wasn't the prettiest thing, but it had so much history and resources and links to pictures. And basically, it's a museum of the history of menstruation. And a lot of people fought to get him taken off, that basically he was doing something perverse, exploitive, kind of like suggesting that it was like some kind of, porn, porn related. And it went all the way to the Supreme Court, and it actually was seen as, no, it actually has a lot of merit. He really did construct a museum of menstrual history and has a collection legitimately, and has done all his research. And so we wanted to share that link because it's fascinating. It is so fascinating, the way women have, how we've managed our menstruation. And you think about what our period tells us, hey, I'm doing what I'm supposed to do. And it really is a special power in so many ways. I mean, think about what it's there for. I mean, you know what I mean? Like, there's no other way that humans get to this planet without periods and women, with uterus. So it's a powerful thing. And a lot of times, since those of you are learning advocacy, anything with power is it which if it comes in conflict with the dominant group, they try to make it shameful and take away the importance and the relevance of it, and kind of make it seem, taboo. So it's a power, and we need to be period positive, I would say.
Thank you for talking about the museum, and thank you for sending the link. I know I'm gonna press on that when this presentation is over. I'm definitely gonna check that out. So thank you. We can, yes. So knowing what you want, you guys covered a lot of this, and I'd love for you guys to I guess repeat it, because even though we know what we want, we often are still scared when it comes to like actually doing something about it. So my question for this is how can we just make sure that how can we raise more awareness on relationship and sex, but what's the appropriate age to start with this? Is it middle school, or is it high school, or is it elementary school? I think that's something people often struggle on. When is the right time for a girl to learn about this?
I think there's different lessons to learn all along the way, right? Like, we want, girls that are 7, 8 to understand that in a few years there's going to be a big biological, physiological change, and that they're going to, most likely have, menstruate. It, as opposed to some of the trauma that some people have had because all of a sudden they thought they were dying because there was blood, in their underwear or on the toilet seat or in bed or wherever they found it. And so I think all along the way there's appropriate things to know. And I think that's the main thing, is age appropriate. And I guess with age appropriate, the way to gauge that would be, what activities is the person involved in, and what life stage they're in terms of their physical body, and also, intellectually, like, or just developmentally, like how, maturity level. So it's really hard to pinpoint that, because we're coming from a culture that said don't talk about it at all. So now we have to figure out, so when do we talk about what, when, right? But the thing that's key is always know what you want, right? Like, for example, we probably oftentimes give more, time to making decisions like, what nail polish color I'm going to use, or what restaurant do I want to go to. You don't just walk down the street and say, I'll just go in here, it doesn't matter, I'll just eat whatever they have. It's like, be that way about your life also, about how you want, about relationships and the friendships. So it is really important to break your own needs and desires down, and not just kind of, be on cruise control and be like, okay, I'm just going to kind of go wherever life takes me. There's a lot of power in knowing what you want and visualizing it, and trying to achieve it. I'll let Karla share more.
Yeah, and I think it's also really important that you're doing what you want for yourself, not what you think your peers will approve of, what they're doing. You know, everyone's different. As Zana said, it's really hard to pinpoint a specific age because there's so many factors that impact whether someone's ready to receive and understand that information. But I do think that it's important to make sure that you know what you want for yourself, that you know how you feel about, you know, different things. And it might be that you need to set aside some time to really, you know, it's something that I think because it's been so taboo that we just don't talk about it, that you might not know how you feel about different things. And so I think it's important to kind of set aside some time to really think about, how do you feel about certain issues? Are you comfortable with, you know, talking to someone if you needed to? Who would you turn to? Where would you turn to for information? And so I think it's important, you know, for you to know exactly what you're comfortable with, what you feel you need to learn more about, what you want for yourself, and not depend on anybody else telling you what you should be doing. You know, because a lot of times I know that it's easy to be influenced by your peers, but everyone's circumstances are different. And so you have to kind of stand up for yourself and say, what do I want for me? And so, you know, we want to affirm exactly what you want from relationships and sex. And so I think it's important to also learn the difference. What is a healthy relationship? Make sure that, you know, you're looking for red flags. And, you know, a lot of things you'll learn with experience and, you know, as you grow up. But I think it all starts with you knowing exactly, you know, how do you feel about something? And what are you willing to accept, or what are your boundaries?
You know, I once heard a health educator who worked with parents on how to be resources for their kids, and basically her message was, if they have those questions, they're ready for it. Now you have to be ready with the age appropriate information and response. But if they're asking questions, that they're ready for it. Now there's some exceptions to that, right? Because we wouldn't want, you know, if you know, a young child is asking questions that are indicative of being exploited, you know, by an older person, those are also red flags. But if they're honest questions about their body and how things work and what to do and where things come from, they're ready for that information. It's our job to deliver it in an age appropriate kind of way, in a way that kind of makes sense. And then, you know, and that's it's really important to know that, because parents really get scared about, they don't know what to say. And it's like, well, you don't have to explain. You know, if somebody asks about, mommy, what are those pads for? And they're 7 years old, you don't have to tell them, you know, what's going on hormonally and estrogen and progesterone and, you know, all this stuff. You don't need to go into that. You don't need to explain menstruation, but you could explain it in another kind of way. You could say, oh, mommy uses these because she has blood and she's trying to keep her clothes clean, and it really helps to stay, you know, clean and healthy and whatever, neat. So I mean, you have, and then obviously if someone a different age, 11, asks that question, it's a different set of information. But overall, if someone is asking, they're usually ready to have the information. It just has to be appropriate for their developmental level.
And Dana, do you want to share a little more about how this came about for the information that we have on the slide right now?
Yeah, so one of, and this is related to advocacy. This is a real life example. You know, a few years ago, our local Planned Parenthoods, we lost them. The organization that managed the Planned Parenthoods for our region, just basically couldn't, run anymore, financially, and closed. And so we lost not only those clinics, but it was also a time when a lot of the feminine women's health centers were also being defunded. And so here we were in a county that that had, maybe about, a list of 50 or so, like, look, these are all the resources we have. And when you called them, it really wasn't the case, right? So, I started working with a group of young women to figure out which resource, which ones are good numbers to call. Like, if I'm going to call, which one should I call? And so we actually, I don't know if this is an old term and maybe you understand it, but we started doing secret shopping calls. So we pretended it didn't cost any money. You need to take notes and, you know, make up a little story in your head and call like your seeking services and then kind of see, you know, what kind of response you get. And so this is interesting. Out of the 50 or so clinics that we had in our county, there was only 8 that met what we thought was a good criteria, which is the phone number works. You can get an appointment within 2 weeks. They know about Family Pack, which is the insurance that state of California has put for anyone seeking reproductive health services in the state of California. And that wasn't even that wasn't even that much. We just wanted a working number and for them to get an appointment and for them to know that you know, we're eligible to get that care paid by the state. And we, you know, and didn't require any parental consent. And out of the 50, only 8. And so one of the things that this group did was decided to develop a pamphlet and said, yeah, it's nice that all those resources exist on the phone book or on the website, 50 of them, but these are the 8 that are responsive. These are the 8 that are going to, you know what you're talking about, know what your needs are, know exactly what to do, set up an appointment, and you know, and get you, you know, the insurance through the state that is required, which is called Family Pack at the time. So when we did that, you know, we thought it was an opportunity not just to put out a list of the 8 out of the 50, but we said, well, what would be some positive messages too? And so these are some of the messages that were developed by that group of peers about, you know, knowing what you want. And I don't think I have to read them out loud, but if there's any particular one, Karla, that you wanted to well, I think the bottom part was the interesting part. Ask yourself if you're having feel-good sex or baby-making sex. Are you trying to get pregnant? Most people who are reproductive age and capable of impregnating or conceiving are not necessarily motivated because they're trying to produce a child. So most of the time, you know, the motivation is human connection with another person, you know, for whatever reasons. They're funny, they're cute, you like them, you want to explore, whatever. But you really need to be clear about this, because when folks are clear about this, then it kind of tells you, well, how do I achieve that? How do I get that and not end up with some of the other consequences that I don't want? Karla, can you elaborate further?
Yeah, so just as Dana mentioned, you know, that's something that a lot of times people are not thinking about. And so we wanted to kind of make sure that people are thinking of that they know, okay, what are my intentions with this? Like, if I don't want to get pregnant, what can I do? So I think it's important for, you know, and I love these questions because I think, you know, even adults, you don't really think about this on an everyday basis. And so, you know, a lot of times, if people are not sure if they want to have a baby, then they might need to find a way to prevent, you know, until they're ready. There are ways for them to be able to prepare their body for a pregnancy if they do want one. But it all starts with knowing exactly what they want out of this, you know, relationship, what they want out of that connection and that intimacy. And just making sure that people are empowered to say, you know, it's okay for you to think about this. We want to make sure, you know, as we have all these affirmations, that it's okay for you to feel like you know exactly what you want, what you don't want, and for you to tell yourself, like, hey, I don't want to have a baby. Let me find a way to prevent, or I do, and let me find a way to get my body ready for that. And then I think, you know, we can tie it into the next slide for the Know Your Rights, because this is something that was also put on that pamphlet that Dana mentioned. The biggest thing that we've encountered in a lot of, you know, my work that I've done with not just the youth, but even adults in our county, is that they don't know what their rights are. They don't know that they have access to make informed decisions for their own bodies. They don't know that they have, you know, the right to get services that are confidential. There's a lot of stigma still in the community. And so, I know growing up, our high school had a health clinic. No one wanted to go because, if somebody was seen going into the health clinic, rumors would be, started about them. And so I feel like a lot of youth lost on a lot of great services just by being afraid of being seen going into the teen clinic. And so just knowing that, the staff at the clinic are not going to tell everybody else any of your information. They're not going to share whatever you were in for. I think it's important for people to know so that, in California, you have the right to any medical care related to prevention or treatment of pregnancy at any age. And, even adults, sometimes they say, well, I didn't go seek this service because I didn't know it was available to me. Oftentimes, in our county, we have a lot of free and low cost services that are not being utilized because people just don't know they're available. And so that's the biggest thing, is making sure that, if your peers don't know, that you kind of help be a voice for them and, help them find resources that are going to help them know what their rights are. Some of the toolkits that we've shared with you, you can share with them. If you hear of someone that might need support in a different area, it's like, well, this is the information that I know. Peer sharing is very important, and making sure that you're sharing accurate information is even more important.
Yeah, so I would say so far in this presentation that knowing your reproductive rights and knowing yourself and knowing what you want is the central theme of just all of public health, especially for women. So I do appreciate you guys really reaching into that topic. Tanya, you can. So for the next question, we have covered that health class is taught in high school, middle school, or you can ask your peers, such as parents or just someone you trust. But people can be embarrassed, which is also something you guys have covered. But with the technology, we can now search it up ourselves, so we don't necessarily need someone else. If we're really embarrassed to reach out to someone, what links do you guys recommend for people to click on so we can learn more about ourselves and reproductive health?
So you can always check with your local health department to see what they have available. So some health departments might have programs that, they're working with teens. They might have peer educators, or, there might be other community resources that you can reach out to. So I would say check with them. But we also have, Planned Parenthood. We're lucky in California that a lot of our clinics are still open. Many other states don't have as many resources as our youth are being able to access here in California. And so, one of the things that they have available is that they have a chat with their health educators. And so, I can drop that link in here too. But, as you mentioned, sometimes you don't want to talk to your friends about it. Sometimes you're embarrassed to talk to an adult or anybody else. And so kind of having that anonymous conversation might be easier. But we want to make sure that you're reaching out to someone that's going to give you accurate information is the biggest thing. And that they're going to be able to support you if there are other needs that come up. And so, Planned Parenthood does a lot of great work in the community. And so they do have this chat feature that's available. In searching, we also found another one called Scarlet Teen Chat. And, this one was started by an author. And Dana, I don't know if you want to share a little bit more about how you found that one.
Well, I used to manage the teen pregnancy prevention programs for the county. That was actually my first job, working with Alameda County with the department. And so, this is a resource that's available from an author who just decided to start being her own advocate and developing her own messages. And so you definitely can be that person. We live in an era now of influencers, but again, you have to know what resources are legitimate and are pro-choice, pro-health, that are actually going to allow people to have to respect their rights and what they want, and what they deserve. So, yeah, I don't, did you want to share anything specific about Sharkeen?
Not specific about that, but just kind of want to reinforce again, as Dana mentioned, we did secret shopper calls here and we still do. So some of our reproductive health resource lists are larger now. And, I've worked on those. So I have done secret shopper calls in English and Spanish. And sometimes it's interesting when providers will say, hey, I was on the list last year, or I was on the list a couple months ago. How come I'm not on the list? And so, it's always important to share feedback with providers because, a lot of times they think that they're doing great work in the community. They think that they're accessible to everyone, but it might not be the case. Some of the clinics, they have a lot of staff turnover. So I think, one way for you all to have support and support others is to, do those secret shopper calls from time to time. That's something that you can start, something easy that, you can start to learn about how are people being treated at some of the clinics, what is the information that they're getting when they call in. A lot of times, there's now providers that know that some people don't like calling, over the phone. They prefer text. So there are some providers that are allowing you to access some of their services or to reach out to their staff through a text message. You can book an appointment online without even having to talk to someone over the phone. And so just know what's available in your area. And if it's something that, you're not able to reach them, that's, the biggest thing. If you're not able to reach them, you're not able to get an appointment, that you have other resources that are available that you are able to access and that you're sharing that with your peers. Sometimes people will prefer to text. And so there are text lines, depending on what the situation is, that people are able to use as well. So it just depends on what resources are available locally to you. But it all starts with you, figuring out what those are and which ones you're actually able to access.
Thank you so much. Girl Up, we are very passionate for making sure we advocate for menstrual equity. So all of this information was very great. As we start wrapping up this presentation, so the lovely thing about Girl Up is that we are all in different communities. I'm in the Los Angeles County, but there are Girl Up people in the Irvine County, the Orange County, sorry, not Irvine, like Irvine, Orange County. So do you have any other last thoughts or recommendations that we should do as we all separate but do practically similar things to make sure that everyone's receiving the care and awareness they should be?
Yeah, so again, I'll just reinforce connecting with your local resources. We do a lot of our work for our county, but we also collaborate. So me as a perinatal services coordinator, there's a group of other, we'll just say PSCs for short, perinatal services coordinators in different counties. And so there's regional groups that come together and we meet to discuss issues that are common amongst our counties. And sometimes, there's always strength in numbers. And so sometimes we're able to collaborate in a regional area. So you're not just doing it for your county, but you're working with surrounding counties to make sure that everyone has, the same resources, the same information, or that they know what the needs in their community are. And I think it's the case for a lot of places, but here in the Bay Area, we have a lot of people that are moving between counties. And so for us, it's really important that we're also working closely with our counterparts in other counties to make sure that if someone is moving from Alameda County to Contra Costa County, for example, they'll reach out and they'll say, hey, I know this person that I'm working with that's moving, what resources are available to them in your county? Can you help me connect to them? And so, you might find that, it might be difficult sometimes to do work independently in your county, but if you team up with other youth that are doing advocacy in their counties, maybe you can work together as take a regional approach to it. Also knowing, again, finding your local resources, but also what coverage is available in the state. There's a lot of state resources also that are available, such as Family Pact. So they provide comprehensive family planning services. So it covers any pregnancy related service. And so I'll drop the link for that as well, because you can see, if you're eligible and what services are covered. And there's also presumptive eligibility. So presumptive eligibility is temporary Medi-Cal, and that's available everywhere in the state, but a lot of people don't know. So one thing that, for me, it's very important that everyone knows about presumptive eligibility, because as I was doing when I first started with the health department, I was doing outreach to families at the WIC clinics, which provide nutrition support. And, a lot of times I was finding that there were pregnant women that were not going to prenatal care. They were already a couple weeks or a couple months, along, but they weren't going because they had applied for Medi-Cal for pregnancy coverage, and they were waiting for Medi-Cal to kick in. And so they thought, while I'm waiting for Medi-Cal to kick in, I can't go to the doctor. Because they didn't know that presumptive eligibility was available. And so, presumptive eligibility gives them that temporary coverage while they apply for Medi-Cal. And so they're able to get the care that they need. And it doesn't just cover prenatal care. If someone, is interested in terminating the pregnancy for whatever reason, it also covers the termination. And so, people were going without care because they thought they had to wait. And so we just want to make sure that, everyone knows that in California, we're lucky that, there are programs in place that allow you to have access to that care, to where you don't have to wait and you don't have to go without it. And so, that's one of the things. And again, if you can't do it with your county, work with your region, and make sure that, because a lot of times some of your region might have similar needs. And so, maybe it could be something where, one of the things that we have in our county is the Perinatal Equity Initiative, and they're taking a regional approach with the, sharing about the program. So there's a campaign to, talk about more about it. And so it's a regional campaign that, several counties have come together to work on. And so it's something that you can do more health promotion, maybe with a regional approach, if you're having difficulty having that support within your county. Dana, did you want to add anything to that?
Well, the only thing I wanted to add is, Family Pack, if you're interested in, that's also, and if you call a provider and you're able to ask for Family Pack and they're aware of it, that's usually a good sign, because with Family Pack, you can make your appointment and you won't have to apply for the insurance until that you show up for your appointment. So it's really important to know that you can get services, that smoothly, that you can make an appointment. They know they know they're a Family Pack provider. You go in and Family Pack, the eligibility is really important. They basically cover anybody who doesn't have insurance, any form of insurance, but they also cover folks who can't access their insurance safely or privately without, someone who wouldn't want them to access services would know. So if you have health coverage for your parent or, some other person who takes care of you, but you don't want to go that route, Family Pack will cover you. So it's really important to know that it's a really short, easy process, as long as the clinic knows that they're a Family Pack provider, and that's oftentimes the challenge. But you should know about it, because you'll be able to. Sometimes you have to let them know, how what you're intending and what you're, again, knowing what you want and knowing what your rights are.
Thank you so much, Karla and Dana, for sharing your thoughts, perspective, and career journey in public health. I'm going to leave it up to Tanya. It was really great hearing from you guys and all the resources you have to offer. The website, everyone, it's in the chat if you haven't checked it now. Thank you. And it was nice speaking with you guys. Tanya?
Yeah. So thank you again, Karla and Dana. It was so nice having you, and I learned so much more from our call today. And we're really grateful to have you here and and the time that you put into creating these slides and talking to us. I think Isabel also dropped a message in the chat. She's a Girl Up staff member. And thank you, Isabel, for sharing that. So if you want to get involved in Girl Up, anyone on the call, definitely reach out to info@girlup.org. And yeah, I just wanted to open up the floor to any questions. I think we only have a few more minutes left, but I just wanted to maybe start with a question of my own. And if you have any questions, feel free to just jump in. put it in the chat. But we talked a lot about different ways you can advocate and share resources. So I was wondering what you think is the best way to have these conversations with girls in our school who you think need it. Is it through social media or like creating some like platform at school itself? What do you think is the best way to have conversations in which girls will feel comfortable talking to us about their needs?
I mean, I share a lot of information through email, and if I'm not kind of friends with that person via email, and more more friends with them like via text or stuff like that. I mean, when you find information that's like, wow, this is great, other people need to know about it. I mean, send a screenshot, send a text the link. There's so many ways now to share information that we didn't have, particularly when Karla and I were younger. And I'm a lot older than Karla, so we just didn't have this way to communicate. And so this is a good time where if you know something and it worked for you or you're interested in it, there's definitely other people. So just like we share, through social media and text, all the other things that we are interested in, this one should be, and make it normal. It shouldn't be like a big deal. I mean, and that's part of making it normal. You're by sending an immediate resource, you're making it more normal and okay for people to ask questions and for people to seek the information. And that's a wonderful thing. Just putting it out there can change how society views it. And I've lived long enough to see, those kinds of changes where I'm like, wow, amazing. There was there was a time when you couldn't even advertise menstrual products on TV. But someone gave it visibility and voice, and we're in a different period now, a different time. So yeah, just you can change norms just by being engaged.
I think also if you're really interested in this work, or you're interested in supporting your peers and being that advocate for them, there might be other people that are like-minded that you can work with. And maybe if your school doesn't have a club, maybe it's something that you can check to see if it's a possibility to have a club. If there's any staff that are champions of this type of work, that they're able to support you. I was in the school newspaper, so I'm always like, I would have loved to have had a section where we could share, reproductive health information. And again, normalizing that, this is normal. It's normal to have these types of conversations. It's important to have these conversations and for youth to know. And so it could be something where you can check in with your school to see, is it possible to add a, section, whether it be monthly or quarterly or however frequently in your school newspaper. Is there a newsletter that goes out that they can input some information into? Is there a club that already exists that could do similar, that could do some of this work? Or if not, could you start a club? I think sometimes people nowadays might feel more comfortable meeting virtually, and that's something that could happen. Also, there's a lot more, as Dana mentioned, than when we had available. I wish we had all the resources that are available now, because I feel like things could have been so much different for a lot of people that I know. But I'm glad that they're available to you all now. And so utilize, the resources. Take advantage of the fact that you can do Zoom calls, you can have virtual meetings, you can FaceTime. There's different ways to go about meeting with others and, people that have common interests that want to do the work together. Take advantage of Canva and other programs that are, allow you to create and to create documents, to create posts that you can share, and always make sure you obviously link the resources and that it's, legitimate resources and information that you're sharing. But take advantage of those tools that are available to you. And, again, if you're, because I'm an introvert, and so I know that sometimes it's really hard, but find other people, because, I found that sometimes, you can work closely with someone and there's strength in numbers, and work together, put something out that you can share with your peers, that you can, like Dana said, you can send through text message, email, whatever way works better for communicating. But just take advantage of those tools that are available to you and of the resources.
Thank you so much. Yeah, and I think the point you brought up about clubs is really important because most of us are part of Girl Up clubs right now and leading one. And Girl Up is definitely a platform that we can utilize to help amplify your message and what we learned here today. So I think if nobody else has any questions, feel free to put them in the chat now. But we'll be sharing the resources from today. I think the links, I'll definitely be sharing them out to everyone. Please share them with your clubs, anyone you think could use them to help with their advocacy and share with others. I think we definitely all learned a lot today. So on behalf of everyone, thank you so much to Karla and Dana for coming and sharing your knowledge with us. So if nobody has any other questions, I think thank you all for coming and
All right, thank you.
Thank you. And I'll put my email in the chat in case there are any follow-up questions.
Yeah, I was gonna say, now you know two insiders in the public health field who are passionate about this and share that passion with you. And so, we're friends now. We know each other. So go ahead, feel free to reach out to us. If I'll put my email also in the chat. But it was really fun to share all this information.
Yes, thank you so much for having us.
thank you. Well, thank you everyone for joining us today. And
All right.
Thank you guys once again.
Thank you.